My name is Rachel Larsson. I'm a naturopath, nutritionist, and holistic gut health expert, and I'm so excited to be here to be sharing with you my naturopathic perspective on gut health. I'll be focusing a lot on IBS today because it's a condition that affects so many of us in ways that, unless you have IBS, you probably don't really believe is happening. Also, talking about what could be really going on if it's not IBS, and how that relates to leaky gut, food intolerances, the mind gut connection, and everything else in between. And more importantly, what you can do to test and potentially start treatment for what else might be going on. So, a lot of great stuff coming up, and I've got some awesome slides to help me present that for us. Okay. So, appropriately called, controversially called maybe, this is my talk, is your IBS BS? And by no means am I saying is IBS BS as a whole, but getting you to question about what's actually going on with your health. And if it's not IBS, what else could be going on? And this is the number one reason I see in clinic for bloating, food intolerances, that it doesn't appear to be that many people are talking about. So I really hope this is new, exciting, and hopefully life-changing information for you. Okay. So I guess, are you in the right place? Is the right talk for you? This would be a good sign if it is, if you're feeling anxious, embarrassed anytime that you eat, if you feel like your health is holding you back, if you're feeling self-conscious, bloated and low energy, and if you're feeling like your body has been hijacked by something else and you can't really put a finger on it, this is a talk for you. So yeah, you're in the right place if you want real, holistic and evidence-based solutions. If you're very, very tired of wasting money on failed plans, expensive supplements, programs and regimes that don't seem to be addressing it from the root cause. If you're tired of being bloated and uncomfortable and having food intolerances and following a life that is low FODMAP, this is for you. And if you resent that your health is holding you back, knowing that you are more than what you're actually showing up to life every day. So I guess a recap on myself, I am a qualified naturopath and nutritionist. I've collaborated with many wellness leaders in the industry. So I love spreading the word and educating and empowering people about their health. Very passionate about self-empowerment, so giving you the skills and knowledge that you need to go forward and make the best life you can for yourself. I have a holistic approach to health, and I mean it when I say it that I have been where you are, and so I come from a place of real empathy and understanding as to how your health can absolutely affect your everyday, every minute of your life. So what you're going to learn today is the number one cause of bloating and food intolerances, if it's not IBS, why it's so commonly mistaken for IBS, how you can test for this, and how you can treat this. So some great stuff coming up. But first, we'll do a recap on what IBS is. And IBS stands for irritable bowel syndrome. It is a chronic and debilitating functional gastrointestinal disorder. And by function, we're talking about a dysfunction in the gut. So there's things that aren't working or behaving correctly where there's a dysfunctional imbalance there. It affects anywhere between 9 to 23% of the world's population, which is massive, and that's going to vary from country to country. There's different types of IBS, so whether it's C being constipated dominant, D diarrhea dominant, A is like alternative, and PI is post-infectious. So these are different subtypes of IBS, and you fall into an IBS diagnosis when you meet the Rome 4 criteria. So what does it look like? You're probably familiar with this, but it's, abdominal pain, cramping, a feeling of incomplete evacuation when you have a bowel motion. Bowel motions that could be, like I mentioned before, constipated diarrhea, completely all over the place. There might be mucus in the stool. There also can be comorbid conditions associated with IBS, being reflux. You might have fibromyalgia, headaches, pain, like backaches can be associated with an IBS condition as well. What causes IBS? So this is where, as a naturopath, I'm really wanting to understand the complexities and the unique circumstances of the individual and person in front of me. It's always going to be a combination of these things because we're complex, and that's kind of what health is. I rarely see health as a cause and effect type thing. We're always looking for the environment as to why it's supporting that current state of health. So in the case of IBS, these are well-known causes and something that we'd be looking at from a clinical perspective if you were to come to see a naturopath for help in addressing and managing this in an effective way. We'd be looking at why it got there in the first place, being is there an immune and infection aspect to it? So that post-infectious IBS affects up to 1 in 10 people that have IBS. So it's a very big proportion of the IBS community. So what's going on with the immune system? Serotonin dysregulation. So from a nervous system perspective, our mind-gut connection is in full swing right here. And it's really a lot about the receptors that we have in our gut and how the serotonin is interplaying with those. Central dysregulation, brain and mind-gut connection. So there's potentially some differences in how the brain responds to pain in someone with IBS. So an increased pain perception or sensitivity perception is something we might need to look at. Genetics, there's been no gene identified yet, but that's something that might be in the future, that they're thinking there could be a genetic aspect to what's causing IBS. And whilst we know that we have the genes that we have, I certainly am not of the mindset that we are victim to our genes. And in fact, there's so much we can do to support healthy gene function. That's a very big other topic called epigenetics. But just because we have the gene, that doesn't mean that we're doomed to a life of doom and gloom. There's lots we can do outside of that genetic picture, or working with that genetic picture even to help that. And the last, but the most important thing that I want to talk to you about today is bacterial overgrowths, and in particular, small intestinal bacterial overgrowth as a huge contributor to symptoms. And this is where we will launch into the, if it's not IBS, then what is going on? The reason why I'm launching into this is because up to 78% of patients with IBS and 40% of people without IBS have SIBO, and SIBO or SIBO is a small intestinal bacterial overgrowth. So the big question is, if there's such a big percentage of overlap of non-IBS and IBS people potentially having SIBO, is your IBS BS? So what is SIBO? As I've said, it's a bacterial overgrowth in the small intestine, and this overgrowth causes gas production of hydrogen, methane, a mixture of both, or hydrogen sulfide gas production. You might be thinking, but isn't more bacteria better for the gut? And the answer is no. When we look at our gastrointestinal tract, we can see that in our large intestine, we want there to be a huge amount of bacteria in there, 10 to the power of 12, which is trillions. Come to the small intestine, we only want 10 to the power of 4 to 6. So that's anywhere between 10,000 and like 100,000, bacteria. So from trillions to 10,000 or so, that is a huge difference in terms of the bacterial colonies and communities that we would want there. So why haven't you been told about SIBO so far? I feel like there's 3 reasons at play here. There's recognition, and whether or not the practitioners that you've been to have recognized SIBO as a valid condition to be explored. Awareness. It is still new in terms of, new in compared to IBS for certain, but still new in terms of our discussions in the health industry. So perhaps it just hasn't, trickled through to whoever you've been seeing so far. And also presentation, which can look very, very similar to IBS. So if there's not the recognition or awareness there, most certainly the presentation will have you thinking an IBS picture. And this is what I mean by IBS picture, but these are the key differences. So when we're talking about SIBO versus IBS, when you have SIBO with IBS, that's right. So SIBO with IBS, you will find that fiber does not improve your symptoms. Antibiotics do. improve your symptoms. Prebiotics do not improve your symptoms. You have bloating very quickly after meals, and you'll find that there's a big overlap in terms of the change and the exacerbation or the triggering of your initial symptoms post food poisoning. If it's run-of-the-mill IBS, you might find, and I guess the biggest difference is that you'll see that fiber improves your symptoms in most cases. Antibiotics do not improve symptoms. Prebiotics, which are these fermentable fibers that we have in many of our foods, high FODMAP is a great example of these prebiotic type foods, will improve symptoms potentially. Bloating will be often a few hours after meals, so not immediately, and it's not necessarily onset by food poisoning. So there are some key differences in terms of SIBO versus IBS from a symptom picture. So do you have SIBO? Key symptoms of SIBO are most definitely the bloating and food sensitivities, and this does mean FODMAPs. However, all of the symptoms that you can experience from an IBS perspective, the alternating bowel motions, abdominal pain and cramping, the associated reflux can absolutely be there. You will also find in someone with SIBO that they could have chronic like iron and B12 deficiencies, and they can be associated joint pain, rashes, and respiratory issues as well. But as you can see, you could switch out the word IBS there, put in their SIBO, or the reverse, I should say, and it looks very, very similar in its presentation. So it's important that we understand that it's your body's response to food rather than the food itself that is the issue. So I know when we're talking about gut health, we're thinking apples make me do this, which I understand. We're trying to explain a trigger, but it's very important to know that it's not the apple that is doing this, it's the body's response to the apple that is what we're actually wanting to address. So by taking out the food, for example, that's not actually addressing the problem, it's just removing the trigger. And as a naturopath, I'm interested with the root cause. I'm interested in terms of the body's response to that food. So trigger removal isn't treatment, it's only symptom relief. That's a key difference, and something I really, really find very important to understand. So when we have SIBO, what does it do to our gut? So it's causes symptom of IBS and is potentially a leading cause of IBS. You're going to get malabsorption or trouble digesting carbohydrates, proteins, B vitamins, lots of minerals, and sugars such as lactose and fructose. This is also where I question whether lactose and fructose intolerance may actually be a symptom of SIBO, perhaps. So the reason why there's so many food reactions is because our small intestine is where so much of our nutritional absorption occurs. So when we have the fermentation of these sugars, it causes a very chaotic environment in our gut. It creates gas. This gas is damaging to our gut wall, which causes leaky gut. And when we have a leaky gut, large particles of food and an immune response is there that shouldn't be. And that's where food allergies and food intolerances can come from. So if you go back, I'll kind of recap that again. Too much bacteria equals too much gas. The gas is toxic to the gut wall. The immune response within the gut wall and the food going through the gut is having an interaction that would normally not be there, and that can trigger immune allergies, food allergies and food intolerances as well. Although I should recap, food intolerances aren't immune driven, they are more the malabsorption of the foods themselves. Risk factors of getting SIBO, the traveler's diarrhea, food poisoning, like I've mentioned, that post-infectious is huge. Overconsumption of simple carbs, so the really high sugar, highly refined foods. Medications can do that, chronic stress, and hello 2020, or I should say hello modern life. We're always on the go. Chronic stress is a huge one I see in clinic. You might have changes in the structure of your gut pending surgery or something like that. How you were born in terms of being breastfed or a C-section will have an impact on your gut health. There is no obviously judgment around that, but it's important to recognize that that may be something that we need to nurture for you. Thyroid conditions, aging, and females. So you can't do much about necessarily getting older or being female. So that's something which we just have to work with it. Gut conditions associated with SIBO. So leaky gut, as I mentioned, how it was related, huge. So if you've got a leaky gut issue, it's not about even healing the leaky gut. It's about why you got the leaky gut. And SIBO may be a component of that. Chronic constipation, no one feels good when they're not pooing. IBS, inflammatory bowel disease, reflux, celiac disease, and diverticulitis are all gut conditions which have been associated with SIBO. Not necessarily SIBO has caused these, but they are definitely tied up and would be wanting to make sure that SIBO wasn't associated if you've got any of these issues. Non-gut associated conditions would be things like acne and rosacea, so a lot of skin conditions associated with gut health, thyroid, hypothyroidism, fibromyalgia, cystitis, non-alcoholic fatty liver disease, many conditions. And I think that brings us back to the whole thing of like the gut being the trunk of the tree, and all of these other parts of our body are just branches off this big trunk. So if that trunk is unhealthy, there's potentially going to be some branches that need a little TLC as well. How do you test for your SIBO? So gold standard is actually going in and having a bit of a biopsy of your small intestine. That's not accessible for all of us, and it's certainly not something that is commonly carried out. What we can do, and happens every week without a doubt in my practice, is doing breath tests where we want to challenge SIBO and test if it's there using lactulose and glucose. This is different from if you've had a test testing you for lactose and fructose intolerance, or fructose sugars, I should say. Lactulose and glucose are the sugars that are used in SIBO testing. And when you consume these sugars and your bacteria, if in a SIBO case, ferment them, they create hydrogen and methane gas, which is then exerted or actually expelled in your breath, which we capture and measure. And so we can actually identify if there's bacterial overgrowths using a simple at-home breath test. So I really want to drive home that this isn't just theory. It's still new in comparison to many other conditions that we've got out there, but there is more and more scientific journals supporting the presence of SIBO and how it's affecting your health every day or every year. So it's definitely a growing evidence-based condition. So this is not a theory, this is science here. There is an answer. So if up to date, there has been this constant, no one can find anything wrong with me, it may be perhaps that we need to think outside the traditional model of health, outside the square, and dig a bit deeper. So peeling off those layers of why. And if we ask why enough, more often than not, we find the actual answer as to why. And there is a solution. So I treat this, and I've helped hundreds of patients, friends and family that have had this chronic gut issues that they haven't been able to overcome. There are solutions out there. Again, lots of evidence also supporting this as well. So exciting stuff. And so I really want to drive home to you that it is possible for you to eat at your favorite cafe again. It is possible for you to wear clothes knowing that by the end of the day, you will still feel confident and comfortable in them, and that you won't feel like you've just all of a sudden become 3 to 6 months pregnant, something I hear unfortunately too often. It is possible to wake up not feeling anxious about food or worried about the embarrassing consequences that may occur. And it is possible to have energy and vitality that lasts throughout the day. So when we're talking about treatment of the gut, it is complex and individual. You are a unique person and you need a unique treatment plan to support that. Your needs are different to the friend or loved one sitting beside you. If we're looking at, is it IBS or SIBO, we must test to confirm what's going on. I really don't like treating blind, and we should, if we can get information there, acquire that information, as it makes effective treatment plans and it's much easier to manage progress. We want to address the risk factors and drivers as to why you got this condition in the first place, or why, even if it's not SIBO, why it's an IBS. So we need to look at you holistically and think about the hows and whys you came to where you are. And if it's something, for example, like chronic stress, we need to be addressing ways to support you through that. And we need to support your upper gastrointestinal tract, so how you're chewing your food, your stomach, all of these parts from like the stomach up. This really kind of influences how the gut, small intestinal down really functions, and we need to make sure that that is also working in your favor. Treatment for SIBO, if it is presented or if it is there, is with the use of specific prebiotics, probiotics, and herbal antimicrobials. This is something that a trained professional needs to help you with, as these things, when done on your own, can be quite uncomfortable. You can get it wrong, you can affect the microbiome, and it can be a very costly, ineffective process. Diet alone is not treatment for SIBO. There is one exception, which is the elemental diet, but it is an extremely strict, very hard 2-week essentially shake diet that it needs to be administered under the care of a practitioner. FODMAPS is something which we may find is helpful for symptom relief only, but from a perspective of a naturopath, and if dealing with SIBO, if we were to take out the FODMAPs, do nothing to the gut, and then put the FODMAPs back in, you wouldn't necessarily see a change, because we haven't addressed the body's response to the food. We've just removed the trigger. So from a naturopathic perspective, we're wanting to change the body's response to food. Ultimately, though, it is possible to be enjoying these high FODMAP foods again, but it may be, from a symptom relief, a good idea to come off of them temporarily. And it is a short-term symptom relief diet only. And we need to support protective mechanisms in your health. So your body has all these lovely inbuilt protective mechanisms that help decrease your risk or ability of getting SIBO. And we need to make sure that that is on your side too. So treating SIBO on your own, as like I mentioned, there's lots of conflicting information and health advice out there, using the wrong tests to assess for SIBO, and also using companies that aren't great quality or don't have great measures in place to make sure their collection methods are accurate and of God standard, using inferior, poor quality supplements. So a probiotic isn't a probiotic. Strains do matter, and we need to make sure that we're using the right ones for your health. You may, if you're following on your own, embark on a cookie cutter approach, which doesn't account for your unique individual needs and circumstances. And following unqualified advice can be very dangerous if we're not looking at contraindications to your medications or conditions or other supplements that you may have in place. But one thing, or a couple of things that you can do to start the gut supportive process, is to reduce or stop grazing. Now, obviously, your individual circumstances, for example, if there is a blood sugar requirement for you to eat a bit more regularly, or a metabolic issue for which that happens, then by all means, keep doing what your practitioner or what feels right for you. But grazing for the rest of us can be something that we can cut down on, and it can be very beneficial in terms of how the gut is getting ready for the next meal. So giving it time to rest, for then it time to be in full swing when you have your breakfast, lunch, or dinner. Reducing or stopping eating 2 to 3 hours before bed can be wonderful. It just makes that lying down process at night a lot easier. The body's not trying to digest food on the horizontal. It is ready to rest. Relax before you eat. So we are multitasking madmen, in modern day living. So making sure that you're taking time off, closing the laptop, putting the phone away whilst you mindfully eat your food, and then you can go back to your busy life, but making sure that you carve out time to focus on digestion. Chewing your food properly comes with eating mindfully. Try to aim for 20 chews per mouthful, which seems like a lot, but not a lot of us are doing. And Iberogast is a product which has got so much evidence behind it, can really help take the cramping and spasms out of food. So that would be, as a one product suggestion, something which for many people is a great option. So you do need an expert in your corner to help address your gut from the root cause, to come up with holistic evidence-based solutions to help you choose through the myriad of options you have in there, specific interventions for your health, and to also go through the conflicting information that is just rampant online, and to also come up with an individualized health plan for you. So this is where I wanted to quickly talk about the Gut Feeling to Healing program. It's the personalized program to, help you love your guts again. It's monthly one-on-one consultations with me, practitioner-only nutritional and herbal support, holistic and evidence-based dietary and lifestyle advice, and many, many resources. Functional testing, where we can test for things like SIBO, leaky gut, your large intestinal microbiome with stool tests and things like that. But also, if you've got hormonal issues, there's a bunch of tests out there that can really assess that as well. We can assist in correcting biochemical imbalances, so making sure you have the nutrients you need to make the products and outcomes you want. So, for example, stomach acid requires zinc. If we have insufficient zinc, how on earth are we going to make stomach acid in the proportion and the amounts that we need to digest our food well? You also get dedicated time for research and test analysis, so we make sure that you optimize our time together. So together we can totally work to empower you with the skills and knowledge that you need to start healing your gut. This is an approach which may be the missing key to what you've been looking for. So even if you've seen several practitioners try countless diets and supplements, this may be something new and exciting and the missing link in your health. So I wanted just to say thank you so much again for sitting here, learning about the gut, learning about IBS. Is it IBS or is it SIBO? How that interacts with food allergies and food intolerances. My name is Rachel Larsson, and I hope to see you soon.